balik ta sa Hello Cebu, Maayong Buntag Pinoy. Nya sa ato nagikaingon kaganina, doon natay espesyal nga dinapit karong buntaga. Partner?
Kauban nato karong buntaga ang clinic founder and director of Form and Function Corrective Chiropractic Clinic. We have with us, visiting us again for the new year, Dr. Scott Jahn. Dr. Jahn, good morning and Happy New Year.
Good morning. How's everything?
Welcome again to Hello Cebu. It's nice to see you again here.
Thanks. It's great to be back.
We have some questions for you
Yeah.
because it's the new year.
Yeah, it's a new year. So your visit, Doc, comes at a time that we just came from all the food binging and all of that from the holidays. So you come from what we call Form and Function Corrective Chiropractic. What exactly is chiropractic? We've heard this before, but could you explain to our viewers what this is?
Sure. Well, in a nutshell, what chiropractic is, it's reconnecting your brain and your spinal cord, which is your central nervous system, to your body. Right? The communication is essential. Your brain and your spinal cord, they control everything, every muscle, every organ, every cell, as well as how much you can heal. So if that communication has interference, your body doesn't heal very well, body doesn't function very well, and it starts to break down. And chiropractic just removes that interference and allows that God-given potential to express itself.
I think I remember before in one of your guestings here that I was asking, are there people that you just see passing by and then you can tell right away, oh, this guy has a problem and I can help him?
All the time.
Yeah.
I say that to my wife every time I'm in the mall. Typically, the biggest thing I see is forward head posture on people. I feel like just tapping them on the shoulder and then telling them they have to come in and see me. But they have to be ready.
Common causes are also because of cell phone use and always being hunched on laptops, right?
Yeah, so we get this forward head posture because we live in a artificial environment, right? We're sitting all day long, most of us, right? We don't get as much exercise as we should. Like you said, we're on our cell phones, and the body's going to grow in the position we keep it in. If we're keeping it in this position or this position when we're typing in a computer, that's the way it's going to grow.
Yeah, well, for 2025, everyone's been slouched, and Attorney John and me, we feel like whatever you're saying now is directed at us. So, New Year usually is the time for health goals, resetting,
Yes.
restarting. And so, when we say health goals, why is this such a great time to focus on spinal health, overall wellness, and we also say that when you have New Year's resolution, it usually ends on the 5th day of the year and then disappears right after. So why do you think this happens? And based on your experience, what are the common mistakes that people make when they come up with their health goals? Like when we say the mind is willing but the body is weak.
So the first thing I'll say is people typically will have health goals based on external environment or judging with other people, comparing themselves with other people. The biggest thing you can do for success is to align your higher values with those health goals, because then change becomes natural. But when you look for that external environment, right, then it becomes forced and it becomes a chore, and your brain, typically a part of the brain called the limbic system, which is the emotional center of the brain, doesn't like that. So it's going to do anything it can do to convince you to go back to safety and security, which is sleeping in the bed as opposed to going out and exercise. But when you align it with your higher values, if my higher value is, for example, that I value my life and my health as an expression of the quality of my life, then it becomes automatic.
A lot of people say that their priorities change when they start a family, when they have kids, they want to live longer, they want to be healthier. So I said earlier the mind is willing, but the conviction is problematic. It's problematic. Others just want to do yoga, but yoga on the bed, so just sleeping. So what do you suggest is a great place for people to start if they really want to be healthier? When we say that, what realistic and sustainable recommendations do you have?
So first, we want to probably get away from the motivation factor, because everyone's motivated at night before they go to bed, right? We set our alarms at 5 a.m., But when the alarm goes off, the pillow's soft.
Yes.
And so we hit the snooze button,
Uh-huh.
right? So the motivation drops, right? We have to be driven by something else. And that's where our values come in, right? If we use our identity as somebody who cares about their health and their life, right, we're going to be driven to make those changes as opposed to just trying to grid it with some kind of a external motivation factor.
Yeah, you mentioned earlier, Doc, about the spine and the nervous system being key components of the chiropractic practice. So, how does that exactly help in achieving like a better sleep, better quality of lifestyle, less stress?
So they're not just components towards chiropractic, they're components towards life expression, right? Like I said before, your brain and your spinal cord are the master control system. And if there's interference in that system, we won't get that deep REM sleep that we need to heal and repair both the body and the mind, right? So we'll wake up groggy and tired, and nobody wants to exercise when they're groggy and tired. We also, digestion will suffer. If we're stuck in what we call fight or flight, which is a survival mechanism, right, the body is going to shunt all its energy towards survival. So immune system will suffer, right, healing and repair, so the body may injure itself and we'll get inflammation, and none of these things are conducive to wanting to get up and move and exercise or to eat right or to get better mental emotional health.
So,
yes.
yeah, sige, Ephraim, go. You started talking about the spine already, and most of the time, when we hear chiropractic practices, we, most of the time, think it's just about the back, because that's what we see, even on TikTok, cracking here and there, and it's always the back. So, can you explain how this supports health in its entirety, like what you said, the relationship between the nervous system and how you deal with stress and how it affects a lot of things?
Sure, absolutely. So the spine and the nervous system, right, is going to send a signal down and out through the spinal nerves to the body, and then the body's going to send a signal back. Now, if your frame is not in the position that God made it, you're going to have interference, right? So that communication system gets interrupted. Right? Think of if you have your children in the other room. The parents aren't around, there's no communication. Kid's going to run wild, right? No discipline, right? If we can clear that interference and get the body talking again, the brain and spinal cord are going to do what they naturally do, which is health and vitality, right? We are designed to be healthy. We're not designed to be sick, right? One thing that kind of irritates me is I get a lot of people that say, oh, my genetics, right? Right? God doesn't make mistakes, right? He made us perfect, right? The problem is we mess it up with the artificial lifestyle, the artificial diet, right? The excessive stress that we have. So we can remove those, and with chiropractic, we remove the physical stress on the body that allows the body to go into switch from a sympathetic, which is a survival mechanism, to a parasympathetic, which is a healing mechanism.
You're talking about healing. In the Philippines, where healthcare is not, if you rate
priority.
healthcare between 1 to 10, I'd say it's a 2. So in the Philippines, you only go have yourself checked most of the time if you feel something painful or if you feel something that's out of the usual or out of the ordinary. When would you recommend is a great time for a person to visit your clinic because other than when they wait for something painful to happen?
First thing I'll say is I'm from America, so if you guys are at a 2, we're at a -2. America spends more money on healthcare than every other country in the world, but yet our quality of life is lower. Right? Our life expectancy is lower than most other countries. Right? So I can sympathize with you there. What I'll say is that there's an old Chinese expression: we don't start digging the well when we're thirsty. Right? We dig the well before we're thirsty. And if you value your life and you value your health, we want to take steps on a daily basis, right? We take a vitamin on a regular basis. Make sure we're getting quality sleep. Make sure our stress is not such that we're constantly in that survival fight or flight mechanism. So chiropractic is going to assist in that. It's like going to the dentist for cleaning. You don't go to the dentist only when you have a cavity. You go to make sure that you have a wellness checkup. Chiropractic's along that same lines.
How often do you recommend in a year that a person would have themselves checked? Because I'm sure Attorney Jahn has a very stressful life with hearings here and there, no? So We don't usually like say, oh, I'm going to a chiropractic clinic today because I just want to see, diba? So I assume you've never been because I've never been.
I've never been, and I think the misconception, Doc, is that you only go there if you have, as you
Back
said,
pain.
back pain.
That's like saying I only go to the dentist if I have tooth pain, right?
Yeah.
No, then you're going to lose all your teeth.
Yeah.
Right?
So how often would you recommend in a year?
It depends on the individual's needs. So if we're trying to correct something, to reestablish proper balance and proper structure, it's going to be a little bit more frequent, like twice a week, depending. We look at an x-ray and see if there's any degeneration or things like that. If everything is fine, then we would say twice a month, because it takes 2 weeks for nerve pressure to start to deteriorate that nerve. So after 2 weeks, the nerve is starting to damage itself and not be able to communicate long term, right? When we never want that to happen, because that nervous system is the lifeblood of our life.
Is age also a factor?
Yeah, as we get older, we don't heal as much, right? We slow down, metabolism slows down, everything slows down.
And we have more stress as we age.
Yeah. And typically that stress piles on top of each other.
Yeah.
Both physical, mental, emotional, and biochemical stress.
Partner, speaking of age, Doc, is chiropractic care also like available, or can kids, senior, the elderly, the let's say athletes and other, say, pregnant women, can they go to your clinic and have chiro care?
Yeah, so chiropractic is for everybody. Right? If you're alive, chiropractic is for you. When we talk about pregnant women, it's a subset that's extremely important, because the nervous system develops by movement, right? And if a baby's developing in the uterus and the mother's pelvis is twisted, right, you have something called a round ligament, which is going to pull on that uterus and create tension. So the baby can't move around. Can't move around, nervous system doesn't develop as well as it should, right? You don't have as healthy a baby as you possibly could. Then after, right, it also, studies show that the birth process is much easier when a woman's under chiropractic care. And when we talk about the baby, right, if you've ever seen a baby being born, right, they use either forceps or a vacuum extractor, they're pulling on the neck, they're turning the neck to try and get the shoulders through the birth canal, right? Very traumatic.
Yeah.
Then what happens? The baby's stuck like this for 9 months, they pull it into extension and slap the baby. There's a lot of trauma there.
Some
The baby
even
becomes
have
colicky.
damage, right, with their body parts.
Yeah, you can get, the nerve can be interfered with, and you can get drop arm or something like that.
So, thank you for that question, because I also wanted to know, no, for minors, for seniors especially because most of the time, ang seniors monggo, they're the ones that really slip easily, they get accidents all the time, so that. But aside from that, I also want to know about the lifestyle that we've been having, especially after the pandemic, where everything's online, even classes are online, so most of the time, people got used to working from home, VA lifestyle, where you just sit in front of a computer, and so then, what damage does that do if you're just seated most of the time, or majority of the day?
Well, number one, it's going to change your posture, right? If we're seated for long periods of time, going from the top down, we're going to see a forward head posture, because typically when we see something, especially something of interest on a screen, we have a tendency to move closer towards it, right? So that's going to...
me.
That's going to take out the protective curve in the neck,
Yeah.
right? So you don't have any kind of shock absorption, and the neck will degenerate a lot faster than it should. Then we'll see rounded shoulders, right? Because we're
I
typing
think
or
he's
something
making
like
an
that.
assessment of me. So, okay.
Rounded
so that's a
shoulder-
common thing,
shoulder,
right?
Okay.
And that'll wing your scapula, right? The shoulder blade there will start to stick out, right? Which we can see that medial border near the spine will start to stick out. And you'll start to get muscle spasm or weakness or tightness in that area. And as we move down, right, as the hips are stuck in a flexed position, we're going to shorten muscles like the hip flexors, right? Which will pull strain on the low back.
And then you cannot walk properly anymore. So it's not panuhot.
It's not
It's
panuhot,
muscle
partner.
spasm.
Even while he is already talking, I feel like
An assessment.
my posture.
That's why I like him visiting, because I always tend to sit up properly. When we were young, our parents will say, sit up straight.
Yeah.
And then now you only sit up straight when Doc John's here.
And so you've mentioned the things that like many people do that they don't expect can actually affect also their posture and also what daily habits, simple daily habits, Doc, can you tell our viewers in order to protect their spine and their nervous system?
Sure. So first thing is to be conscious of your movement, right? If we start from the morning, right, we should wake up and start with some form of exercise.
Oh, you don't wake up and get your phone right away? I thought that's the default, no?
For the first 10 minutes until I wake up.
No.
But a 20-minute walk in the morning is going to do wonders for you. Number one, it's going to stimulate the nervous system. As I said before, the nervous system is a sensory-based organ. So we want that signal getting to the brain to wake it up. It's going to release a lot of
Can you
hormones.
please
and
tell
endorphins.
him so that he wakes up? 20-minute walk.
It'll
Okay.
also do wonders for your mental emotional aspect. Right? Studies show that a 20-minute walk is just as effective as, say, a drug like Prozac or something like that, and no side effects other
So
than
best in the morning, Doc, not in the evening.
Well, the reason why it's also good in the morning is because you get morning sun, right? And sun exposure is going to give you vitamin D, which is great for immune system, right? It's a hormone more than a vitamin, and it's essential for a good health. Not to mention that the day gets very busy. If we can start the day off with a win, right, we feel like the rest of the day is going to be okay. Versus towards the evening, we're tired, right, stressed, we have to deal with kids, right, things pop up all the time. We get it out of the way in the beginning, right, you're already a success.
Best to start the day. Also, going back to neck, back, and spinal issues, what's a warning sign that we should not ignore? Because as I said before, I don't know if you've heard this, maybe you did, when you say panuhot is a term that people in Cebu use, but medical experts really don't believe it, you know. So when there's pain, panuhot, and then you put liniment and all.
Yeah.
So when
Rub
do you
something.
know that this is already something that you should not ignore?
So first, we shouldn't ignore pain. Again, if we go back to our dentist example, if you had a cavity and your dentist just gave you a painkiller, you wouldn't go back to that dentist, right? You want to get to the cause of the problem, right? So there's always a reason why we have pain. So just to subvert the pain with some kind of a drug is dangerous, right? Because the degeneration, the dysfunction is going to keep on going until some disease process pops up. So after pain, we're going to get swelling, right? And again, swelling seems to be, at least in the medical community, the cause or the bad guy in the group. But swelling is the first part of healing, right? Anytime you get swelling and inflammation, that's the body starting the healing process. So we don't want to take an anti-inflammatory. We want to, number one, understand why we're getting the swelling. And then number two, assist the body throughout that swelling process, right? But not subvert it, because the body's always going to try and do whatever it can to protect you and to keep you alive. After that, we're going to get muscle spasm or tightness. Muscles move bones. So if bones in your frame are off their axis or off their center of gravity, muscles are going to tighten up to try and lock that down, right? That's why when we get a massage, it feels great, but the next day the muscle's tight again, right? Because the frame hasn't changed, right? And the muscle has to take over part of what the bones are supposed to do, right? After that, you're going to look at posture, right? My clinic is called Form and Function for a reason, because your form is going to dictate your function. And as I say all day long, you can't improve on God. God designed your body to be a certain way, right? Level on the front view and aligned on the side view.
Is this how God?
So if we're off, right, the function is going to be off.
Okay.
And it's going to have stress in inappropriate areas, which is going to have some kind of dysfunction.
Now, Doc, for someone who hasn't like tried chiro before,
Like us.
like us, will we break our bones? That's the first question during the first session.
What happens on
what
the first
happens?
session? What can we expect?
So typically when a patient comes into our clinic, right, we take a thorough history to find out how much trauma and stress they've been under. Okay. After that, we're going to look at their posture and see if there are any abnormalities in that. We're going to check movement patterns to see if there's dysfunction in the movement. Right? Then we're going to see how the nervous system is working. When we find dysfunction, chiropractors do what we call an adjustment. We move the bone, that pseudo armor that protects that delicate central nervous system into a better position that's going to allow better movement. It's going to take pressure off the nerves, allow better communication, and allow the body to do what it naturally does, which is heal and repair itself.
Is it going to be painful?
Typically, no. And I say typically no because, as I mentioned before, muscles move bones. So there's a fear factor here
Yes.
where sometimes patients are uncomfortable and they'll tense up a little bit. And so the muscle is tense trying to keep that bone in place, and I'm trying to fight against that muscle. So if we're not relaxed, maybe just a little uncomfortable, but we have techniques to try and distract you. I'll tell you a funny joke, which I think is funny, but other people don't. And then we move the bone when you're not,
Okay.
you're not
We
expecting
need to
it.
visit your clinic to get
For the joke.
for the joke.
Okay.
Yes.
Okay. So is this also safe? Because a lot of, older generation do not do this, do not do that. It is
Myths.
dangerous. Yes, yes.
So chiropractic's extremely safe if you go to a qualified chiropractor. I know there's, last year there was a big news story of someone down, I think, Hagen de Oro,
Yes.
of
It
breaking
became
someone.
viral, right?
Yeah, well, he was not a chiropractor. He was a bone setter. I don't know exact, but I know he didn't go to chiropractic school. He did a manipulation which no chiropractor would ever do, and unfortunately the gentleman died. So you want to go to somebody who's qualified and trained. After that, I say that chiropractic is perfectly aligned with removing any interference and allowing God's intelligence to flow through you, right? When you do that, everything works and miracles happen, right? It's not dangerous at all. Last thing I'll say on that is, if you look at actuaries in insurance, right? Those guys are pretty smart because they have to keep the money coming in. My malpractice insurance is low. Right? A medical doctor's malpractice insurance is higher just because of the nature of their job. And I'm not saying that nobody should not go to a medical doctor because they save lives on a daily basis.
Yes.
But the risk is a lot higher, right? Because we have adverse effects with drugs, right? And then if there's surgery, the malpractice is really high because things happen at no fault of the doctor. But the risk is much, much higher than something that we would do.
Is it also crucial for a person who hasn't been so active and then decide for healthier lifestyle and be more active to see you first before doing something strenuous?
I would suggest yes, because everything starts with the nervous system. If your nervous system has too much interference and you're in a state of survival, to put more stress on that system is going to just put you into more of a survival state. You're going to release something called cortisol, which is very inflammatory. Right? You're not going to get the benefits that you can. Additionally, the people who eat maybe say, oh, well, I eat a perfect diet. But if you can't assimilate that food, if it just comes in and goes out and the absorption is not there because your digestion is off because your nervous system controls that, and if that can't do that properly, right, the diet we eat is going to be ill-effective.
Doc, I'm curious, how has been the reception here in Cebu for chiropractic care? I mean, are there many Cebuanos going to your clinic and realizing that they need this in their lives, or do we still have room for more people to be educated?
So the reception has been great because anytime I look for a country to go to, one of the first things I look for is what's the religious factor in that country, because people who maybe don't believe in God, chiropractic maybe not be as much for them, and they look towards a medical community. People who believe in God, which most Filipinos do, right? They understand that God's intelligence flows through us. We have health and vitality. Interference in that system, and we don't. And we don't need to look towards some external potion, lotion, something outside of the intelligence that we were given at birth to make us healthy. Right? If we can just express more of our potential, right, that's when miracles happen.
Okay, so another question, personal question, because Apple Watches, right, they check your steps. And then there was one time, I wasn't really curious about it, but there was one time I was told, or it prompted that there is a problem with your balance in your steps, and there is a high chance later on that you might be prone to falling. So these prompts, have you also received this here in Cebu? Is this common?
I'm not familiar with Apple Watch. I'm old school. I got a regular watch. So I'm not totally familiar with that. What I will say is that if your gait is off, your walking right, is off, you have something called proprioception. That's your body's ability to know where it is in space without having to look at it. Right? That's due to nervous system control. And if that's off, we're going to walk and we're not going to know exactly if our foot is on an even setting or whatnot. We could twist an ankle, right? The risk profile for injury goes way, way up, right? Also, if our balance is off, right? If our structure is off, our weight's going to be off. Think of a car that needs wheel alignment, right? If that tire is sitting crooked, you're going to get excess of wear on one side versus the other. Same sort of thing will happen with the body.
Ah, okay. Is that something that you can check when people go to your clinic?
It's not only something we can check, it's something we can drastically improve.
Ah, okay.
So, Doc, if we would want to talk more, a little bit more, but in the interest of time, Doc, if you have one powerful message to our viewers who are watching us right now, this new year, what would that be?
So my one take-home message is this. You weren't born flawed. You were born perfect, right? Trust the design that God gave you. It is perfect. If you are suffering from some kind of disease, some kind of illness, it's because there's interference towards that intelligence that we were given. Okay? If we can restore that intelligence, support the body with what it needs, right, biochemically, mental, emotionally, spiritually, and physically, right, you're going to express all that God-given potential. Right? And then, again, that's when the miracle happens.
That's a powerful message, partner.
Thank you so much, Doc, for visiting. And please invite our viewers to visit you, how to reach you if they want to try.
How can we book an appointment?
So, our clinic is called Form and Function Corrective Chiropractic. We're located in Apple One Tower, which is right across from Ayala Mall in Business Park. The easiest way would probably be to go to our website, which is formfunctionchiropractic.com. And there you can learn more about our clinic, more about what chiropractic is. You can book an appointment either online or our phone number will be there. You can give us a call and our staff will be happy to help you.
Do you also have social media accounts, Doc?
Yeah, we have them all. Facebook, Instagram, X. They're all, and links are for those are on our website as well. You can find us there.
Thank you so much again, Doc. We look forward to learning again more from you the next time you come back. And perhaps fixing what needs to be fixed with...
Every new year.
Not
He comes back.
necessarily. But thank you so much. And
Thank
then
you,
Doc
me.
Scott.
yes, thank you mo. Balik mi, human sa pipila ka pahinumdum. Please stand by.
Hello Cebu, hello Cebu, Maayong Buntag Pinoy, Maayong